Hello, good afternoon everyone. My name is Elle and I'm a quarter 10 student here at Sonoran University. And I just wanted to thank you guys for the opportunity to speak here today. I'm so incredibly grateful for all the donors. But a little background on me, I didn't have the most conventional childhood. I grew up in a family-run 30-room motel on the edge of the Rapacz reservation in a town of about 4,000 people. My parents immigrated from Poland, knowing very little English, but they had a can-do attitude that translated into, our child can definitely handle room service. For 14 years, my daily routine was 8 hours of school, followed by 6 hours of folding fitted sheets and keeping people happy when they're tired, grumpy, and wondering why the Wi-Fi wasn't working in the middle of the mountains. Honestly, it was the best and most exhausting pre-med training I could have asked for. But jokes aside, the motel wasn't my first lesson in humanity. It was my first lesson in humanity. I met people from all walks of life, and I heard many stories of what happens when people are left behind by the healthcare system. Just as we were getting a handle on running the motel and figuring that out, I was diagnosed with type 1 diabetes. So suddenly hard work wasn't just about running a motel, it was also about staying alive. So as you can imagine, my childhood wasn't necessarily easy, but it gave me something medical books cannot teach, and that's empathy. So with that, I decided to become a naturopathic doctor because I didn't want to treat patients just like I had been treated, just a number on a chart. I wanted to treat people, as a patient. Now I'll be honest, I'm a Polish kid. We treated colds with garlic, and if you had a stomach ache, you'd get more garlic. So when I got into med school, I didn't see or know much else than treat it with garlic. So when the universe decided to humble me with something that couldn't be treated with garlic, it was awakening. I developed debilitating vertigo my first couple of days here at school. And I was dizzy, I couldn't drive, and I was pretty sure I had to quit my medical career before it even started. So I remember hearing about this acupuncture DSDL from a couple friends where students would come in, practice their skills, and basically helped treat students who are going through fatigue and anything that you can imagine. So I was going into it, I was like, sure, type 1 diabetic, a couple more needles wouldn't hurt. So 20 minutes later, I realized that the room stopped spinning. I felt human again for the first time in a couple months. So I was so amazed at what happened to me that now every week I'm practicing my acupuncture skills at that same DSDL every week. And I got so passionate about it, I explored more and I discovered applied kinesiology, which mixes acupuncture along with other diagnostic skills together. And I'm so passionate about it that I'm now the president of that club, so I can teach it to other students because I realized how much it can help people and impact others. But here's the reality. Passion doesn't pay for test strips, and grit doesn't cover medical school bills. So the Dr. Yong Deng and the Dr. Lim scholarships are the reason that I can breathe and focus on skill and diagnostic development. Because of your generosity, I have the momentum and help to keep moving forward. It means that for this month, I'm not choosing between my medical bills, my insulin bottles, and my clinical supplies. It allows me to focus on my clinical training, community outreach, and coordinating applied kinesiology certifications for my peers. You're not only helping fund my degree, but you're helping me open my future practice to care for patients. So to the donors here today, thank you for seeing the value in a motel kid turned doctor. Thank you for investing in a future where healthcare is about treating patients and their balance. And if you're having any issues with the internet, don't ask me. I'm officially off the clock. Thank you.